So 2 weeks, possibly more. No alcohol sales, schools shut down, leisure travel in and out of Gauteng lockdown. All in a bid to ease pressure on our hospitals. Well, to discuss this, I'm joined by Kevin Halama, spokesperson for Hospersa, the Health and Other Services Personal Trade Union of South Africa. Thank you so much for your time. Talk to me about the people you represent in our hospitals. What are they telling you about how things are, particularly in Gauteng's hospitals?
Good evening, Sally, and the viewers. The word on the ground, Sally, it's been some time that we've been calling for stricter measures in Gauteng, mainly because our members in Gauteng have been complaining about being overburdened, and also the fact that there isn't enough beds within Gauteng, especially when we saw that they were getting in a lot of the new variant virus spreading rapidly within the province. We had called for stricter measures much earlier. Therefore, we do welcome these new regulations that the President announced yesterday, in that we feel it will definitely assist with curbing the spread of the virus, especially here in Gauteng.
Yeah, so the bed issue is really the most pressing. Obviously, the booze ban, it's well known. I think you speak to any doctor or nurse who's ever worked in a trauma ward, and they will say that you can set your clock by Friday evening when drunk trauma patients start rolling in. So that is, I'm sure, also welcomed by your union, Hospersa. In terms of the bed situation, what does the union want to see happen? I mean, we keep hearing about the extra beds being set up at Baragwanath. We've heard today that a part of Charlotte Macleay has reopened. Of course, it's only for cancer patients. And we also know that there's the Anglo Gold Ashanti unit. Where is the crunch on beds most particularly, and what does the union want to see change?
I lost you there a bit, Sally, but I got a gist of your question. I think from our side is that the issue around beds is quite critical, in that if you recall, during the first and the second wave, there was quite a lot of beds that were available here in Gauteng. I mean, we had a site there in Nazareth where people were being admitted. Even there at Charlotte Macleay, there was additional bedding that was available for COVID-19 patients. The one thing which we need to highlight, Sally, is that the beds need to be accompanied by human resources as well. We still feel that we've lost quite a lot of healthcare workers during this pandemic, and the department has done very little to ensure that that human capacity is filled. I mean, we went into the virus, into this pandemic already with a short staff across all the country in terms of not having enough nurses, enough health professionals, and even now the situation is even worse in that those vacancies have not been filled. So we feel that the beds should also be accompanied by ensuring that we employ a lot of nurses and as well as more healthcare professionals.
Are you able to update us at all, and I'll understand obviously if you don't represent them, on the situation with the unplaced junior doctors?
The last that we had, Sally, was actually a media statement from the National Department of Health just recently, I think over this weekend. It stated that they are looking at addressing the issue of employing those doctors. But it was vague, honestly, Sally. We still feel that there's quite a lot that can be done by the department. We have a group of health professionals who are called the community healthcare workers. We feel that that group or that category can actually do quite a lot, especially in the local communities, because the one thing that we feel that is also not being addressed by the department, Sally, is that the communication aspect of this pandemic has been very poor, especially when we are reaching the peak times where a lot of cases are being reported. We're seeing that in a number of local areas, especially the congested areas, there isn't enough attention that is being given to ensure that people are being reminded of the precautions that they need to take. Therefore, even these regulations, yes, they may be announced, but it doesn't mean that the enforcement is there. Hence, we feel that that category of workers, the community healthcare workers, can really assist in that they can drive into the communities and drive in the message of that people need to wear their masks, they need to sanitize, and we feel they need to come in. It's not just the main ones, which are your nurses.
You know, Hospersa, I think it was about 10 days ago, called for the appointment of the Tourism Minister, Mamaloko Kubai, as acting health minister to be reversed. I wonder if you've had any response, at least perhaps an explanation, as to why someone without medical experience was appointed to this crucial position.
To be honest, Sally, we haven't received anything, and quite shockingly, we're very disappointed in that. And to add to that, Sally, I think at some point we became complacent in terms of the management of this pandemic. When there was all these allegations around the health minister, I think probably even the department itself, they dropped the ball somehow during that transition, in that even now, some of the decisions that are being taken now, they could have been taken quite sooner, especially the issue around Gauteng having stricter regulations, mainly because we could see that there's quite a huge spread, noting that the Mateke Hospital wasn't operational at the time, and there wasn't even enough beds. Now we've allowed the situation to exacerbate throughout the country. Now, the second thing, Sally, which I actually also wanted to raise, is the slow pace of the vaccination, which I think the acting minister coming into this position, it comes with a lot of challenges, in that you need to make critical decisions about other vaccines like your Sputnik, of which there I feel we do need someone which has medical background that can come into that position with just a bit more than just an administrative function.
All right, well, thank you so much for your time this evening. That was Kevin Halama, spokesperson for Hospersa, the Health Services Trade Union of South Africa.